Hi everyone. Today we're going to be talking about medication management. This is session 6 in your workbooks. So today you will need your workbooks, of course, your blood pressure monitor, just because you need to, if you haven't checked your blood pressure already, please check it. And if you could send me your blood pressure reading. I would love to know how it's going. Once again, I did send an email 2 days ago asking a couple questions as far as if you completed the survey. If you haven't completed either survey, please do so as soon as you can, because we are over halfway through with this workshop. So the last session is after this session, we have 2 more. So we have next week, which is Monday and Wednesday. So we're kind of wrapping up at this point. So yeah, I need both surveys. I need your blood pressure, last blood pressure reading. And then there was one last thing. Oh, then I asked how your action plans were going. So as of right today, you should have session 1, session 2, and session 3 action plans complete. We did not do a session 4 action plan. That's when we did a Q&A with Jacqueline Dam for tobacco cessation. But today we'll do an action plan. So after today, you will have, then you'll have a physical activity action plan. So you only have one current one as of right now. So you ended your session 3 nutrition action plan, and you still have your session 5 physical activity action plan to complete. So I also asked for an update on how those first 2 went, as far as, because that was the first time we went through the whole process. And yeah, I'm just curious how everyone's doing. All right, so if you turn to page 2 in your workbooks, and you also, so for this session, we won't be really going over these. I mean, these pill box organizers are pretty self-explanatory. I gave everyone 1 week's worth, I believe. I do have extra, so if you would rather organize your pills for 2 weeks, please reach out to me and I can get those in the mail. I can mail some out to you. And then also the My Medicine card. So this is another thing we'll be going over. We'll be writing down all of our prescriptions and why I take it, the start date, refill date, how much I take, and then when do I take it. So we have this, so it actually folds up, so it's supposed to go in your pocket. It's supposed to go in your wallet. So it's kind of folds up like this. Super handy. So we will also be filling this out, or filling out a sheet, and you'll kind of transfer what's on that sheet to this little handout. All right, so I'm going to share my screen because we have a couple slides we need to go over. All right, so medication management. So these are the questions after this session. You should be able to answer these questions. Why should you follow your doctor's advice when taking your medicine? If you take any medicines or supplements, should you tell your doctor? How can you remember to take your medicine? And then what should you do if you have a question about your medicines? All right, so taking medicine isn't always as simple as swallowing a pill. Medicine can only help people if they take it as prescribed. In this session, we'll discuss what you need to know if you're taking medicine for high blood pressure, heart disease, heart attack, or stroke, or I apologize for that, or to help prevent any of these conditions. We'll talk about how you may need to take medicine, how to get it, and how to take it. You'll learn how to watch for problems with your medicines and to be active in solving these problems with your doctor or medical team. Once again, so this session, it actually might be pretty quick just because this is a very interactive session. If we were to do it in person, there's a lot of me asking questions, and the whole group, I have a flip chart and I'd write down everyone's answers. So since we can't do that, I would just kind of go through the most common answers. But keep in mind, yeah, this session usually is longer than what it will probably be online, just because we can't have that interaction. Your doctor may give you 1 or more medicines depending upon your particular symptoms and health problems. Sometimes your doctor may prescribe 1 medicine at first and then add others later, or your doctor may give you 2 or more medicines at first. Whatever medicine your doctor prescribes, taking your medicine exactly as the doctor advises is very important in preventing and treating high blood pressure. You know, it treats and prevents high blood pressure, so heart disease and strokes. We want to make sure we get all three of those. It's important to know that although medication cannot cure high blood pressure, it can help significantly reduce and control it. Often the doctor has to make some minor changes in your medicines to be sure you're getting the amount that works best for you. After starting a medicine, you'll be tested regularly to make sure the medicine is working. If it isn't working, if it isn't working as a doctor would like, you may get a higher or lower dose or just a different medicine in general. They will also add, if you're only taking one medicine, they'll add another medicine. So it's definitely not a one size fits all. So you may be on a different medication for high blood pressure than, say, your friend that has high blood pressure that's also taking medication. So keep that in mind. So the medicines work best when taken as advised by the doctor. Skipping a dose or stopping your medicine can be harmful. Your health may get worse if you stop your medicines. Do not stop your medicines unless your doctor tells you to stop, even if you are feeling better, which is very common. A lot of people think, oh, I feel great, this is awesome, but you feel great because you're taking the medicine. It's working, it's doing its job. So continue to take it. Do not stop taking it without consulting your doctor. And then follow your doctor's instructions about when to stop taking a medicine. Do not take more of the medicine than your doctor tells you to take. If you do, it may harm you. Your doctor will tell you when to take more of any medication. If you're not feeling better or you're feeling worse, be sure to tell your doctor or nurse. Keep prescriptions for your medicine filled at all times. Refill your prescriptions several days before you run out. You should have enough medicine for a few extra days so that you won't run out if the weather is bad or you can't go to the pharmacy. Especially here, I'm in rural Montana. If there's a storm, it's icy out, you really don't want to go out to the pharmacy just to get medication, especially if the roads are bad. So be prepared. If you're going on a trip, be sure to fill your prescriptions ahead of time. Anytime you'll be away from home, be sure to take your medicine with you. Be sure you know when your doctor and pharmacy will be closed for holidays. If the cost of medicine is a problem for you, tell your doctor. The doctor may be able to prescribe other medicines for you that cost less. Some medicines have a generic form that costs less than the brand name. You may also be able to lower your cost by comparing prices at different pharmacies or buying some medicines from mail order pharmacies. If you need help paying for medicines, ask to see a social worker while at the hospital or health clinic, and don't be ashamed to ask your doctor to contact a social worker in your community. That's why they are there. They are here to help you with these resources. They would definitely rather have you ask for help than versus not take the medication because it's too expensive. The social worker will know about programs that can help you pay for your medicine if you qualify. Also, a staff member in the doctor's office or health clinic may be able to help you fill out forms for getting low cost or free medicine from drug companies or through the Medicare prescription drug card program. It is very important you tell your doctor about other medicines you are taking. You should include all pills and remedies that you take, including over-the-counter medications that you buy without a doctor's prescription, herbs, and vitamins. Examples are aspirins, cold medicines, allergy medicines, and laxatives. Taking over-the-counter medicine or other supplements can change the way your prescription medicines work. Every time I do this workshop, I also know essential oils. So if you use essential oils, those are known to also affect how your medication works as well. So I know a lot of people use essential oils now for a variety of different reasons. Also, tell your doctor about any allergies or other problems you have to medicines, foods, or chemicals. The doctor needs this information so that he or she can prescribe the right medicine for you. If you begin to experience side effects while on the medication, you should talk to your doctor or healthcare provider immediately. If you turn to page 3 and 4 in your workbooks, so it kind of just goes over the highlight. Page 3 goes over kind of the highlights of what we just talked about, and then also page 4 is this is where you want to list your prescriptions and over-the-counter herbs, vitamins, whatever it may be. That's where you want to list those medications. So once you list those medications, put them on, transfer that information onto this card, into the My Medicine card. Once you have this filled out, fold it up like that, it already has creases, and stick it in your wallet, just in case you're at the doctor's office or pharmacy, whatever it may be, and you forget what you're taking. I know a lot of medications, it can be overwhelming, the name, especially if you're on several. So put in your wallet, it's very handy. And then also make sure you put your name on it. And if you turn to page 5 in your workbook and then fill those answers out as I continue on. These are the people that will have the most knowledge about your medication questions. The pharmacist, the person at the pharmacy who is trained to help you with all your medications, your doctor, or a nurse that will answer your questions. If you have questions about your medicines, the easiest way to get any answer may be to ask the pharmacist who gives you your medication. The medicine will come with information about possible side effects, which are problems that may come up when you take it. For example, some diabetes medicines can cause an upset stomach, and some blood pressure medications can cause leg cramps or cold hands and feet. Tell your doctor if you think a medication you are taking is causing a side effect. Do not stop taking the medication unless your doctor tells you to stop. Talk to your doctor first. The medicine will also come with warnings not to take if you have certain conditions such as allergies to certain medications or chemicals, or if you're pregnant. The medicine may also come with directions for taking it, such as taking it at a certain time or staying away from certain foods or another medication. Again, if you begin to experience side effects with any medication that you're on, you need to talk to your doctor immediately. I'm going to check the time really fast. Okay, so before we continue, I'm going to pause right here just because if I keep these videos about 15 minutes each time, they just kind of upload a lot smoother into YouTube, and that's why I'm kind of separating them. And also, I think it may be easier for each of you to watch 15 minutes at a time versus maybe one 30-minute session. So this is part 1, so I will pick up where I left off on part 2 of session 6. All right, let me stop sharing my screen really fast. And then, all right, I'll see you soon.